Dennis Meyers. I'm a dietitian at Johns Hopkins, and I take care of kidney and liver transplant patients. Part of my responsibilities are seeing patients when they're being evaluated for transplant, and then I also follow them in the hospital after they have their transplants. Now, in our clinic, when we evaluate people who have kidney disease, we evaluate whether they're on dialysis or not, what stage of kidney disease they're at. And what I do is I ask the patients, has anyone spoken to you about diet at all? Because if they're diagnosed, most of the time when the patients come to see us, they've seen a nephrologist already, but there are some patients who've been told that they have kidney disease by their family physicians. And so what I am checking is to see if they've been told anything about diet. When someone has chronic kidney disease, depending on the stage of chronic kidney disease, the diet may have to be controlled. There's certain things such as sodium, potassium, phosphorus, protein, and fluids that may have to be restricted in the diet. So during this session in the clinic, what I see is the knowledge that patients have about these dietary factors. So during the clinic visit, what I evaluate is what stage of chronic kidney disease the patient may be at. It's all based on the KDOQI guidelines, which is based on the glomerular filtration rate, which is just a way of evaluating the amount of kidney disease that someone has. And once a patient gets down to like what we call stage 3, usually the diet has to be controlled somewhat, and that we may ask you to restrict your protein. Your potassium may go up, and so foods that are high in potassium may have to be restricted. Sodium is always good. I mean, most of us should follow a sodium control diet anyhow. Less than 2,400 milligrams is what is recommended by everyone. And also, we recommend that everyone follows a so-called heart healthy diet. Low saturated fat. And so we discuss all these things at this session. Now, if someone is already on dialysis, that person probably has seen a dietitian at the dialysis unit, because Medicare requires that all dialysis units have dietitians to see the patients and review the monthly labs. And it depends what type of dialysis that you may be doing. If it's hemodialysis or peritoneal dialysis or home hemodialysis, the diet may be changed according to the type of dialysis. And then, so we base the dietary recommendations on your labs, as I said before. So if your potassium is high, I would recommend a lower potassium diet. Or if your phosphorus is high, I would recommend a lower phosphorus diet. So not every individual needs the same diet. During this session, I'll also talk about what you will need at the time of transplant. At Hopkins, I come around and see you right after the transplant. I look at your lab results, and we prescribe a diet based on your kidney function. So if the kidney is working well, of course there would not be a need for fluid restriction. The potassium and phosphorus should get better. Post-transplant, the medications do cause some problems, and we have to evaluate if someone's sugars are high as a result of some of the immunosuppressants that you're taking. So some people may need to be on carbohydrate control diets post-transplant. And of course, then we always recommend a lower sodium and heart healthy diet. So post-transplant, as I said, we evaluate all these factors. Post-transplant, you will have increased calorie and protein needs to help with wound healing and to offset the side effects of the medications. The steroids do break down muscle mass and increases your protein needs. So protein is not restricted in the first couple of months post-transplant. And as I said before, we want patients to follow a heart-healthy diet, because some of the medications can cause increases in lipids, and some patients may need lipid-lowering medications to help with this. And also a heart-healthy diet, low saturated fat, will also help with lipids, so we recommend this. As I said before, Some people do have an increase in their blood sugars, and we may ask them to check their sugars at home, and then to control their carbohydrate intake. The good thing about the post-transplant diet is it's not as restrictive as the pre-transplant or dialysis diet. The phosphorus will go down very low, and patients can have a lot more phosphorus in their diet. So we will ask you to take in more dairy products, more calcium, milk or alternatives to milk such as yogurt. We want to help prevent osteoporosis or bone disease after transplant, so we will recommend a higher calcium and vitamin D intake. And once you're discharged from the hospital, you will be coming back to clinic once a week and getting your blood drawn twice a week, and we will follow you I will follow you in the clinic. Our patients can always contact me. It's important afterwards, as I said before, to continue to monitor the electrolytes, which we do in our clinic. We monitor the blood sugars. Often patients have questions about will the steroids cause weight gain, will the prednisone cause weight gain, and it does with some people. Some patients have to watch, be a little bit more careful with their calorie intake. We do recommend exercise for everyone. Exercise will help in blood sugar control, will help in the lipid control, will help prevent weight gain. So once you're up to it, we do recommend that you do some kind of exercise, whether it be walking or whatever exercise that you like to do, and we'll discuss that with you. So then, long term, the diet recommendations would be pretty much what we recommend for most people, and that it's about 1 gram of protein per kilogram, and that you don't need a real high protein diet after about 3 months post-transplant, as your wound should be healed and as the steroid doses should be lowered. So that the diet then just becomes what we do recommend for most people is a heart healthy, sodium less than about 2,400 milligrams a day, low saturated fat, and low cholesterol, and what we commonly just call a heart healthy diet. And then if you do have blood sugar problems, it would be carbohydrate control. We do recommend increases in fiber and more whole grain foods, whole grain wheat products, and which is different from the dialysis or pre-transplant diet, in that often the dietitian will probably tell you to have a lower phosphorus intake and often tell you to eat white breads, but this changes post-transplant, and that we want you to have a higher intake of whole grains, and the phosphorus shouldn't be a problem anymore. And so dietitians are always available. I'm available by email or by clinic visits. There are good websites. The National Kidney Foundation has a good website that have sample menus and some cookbooks and lists of like low and high potassium and low and high phosphorus foods. So if you don't have a chance to talk to someone in the clinic, or your doctor doesn't have something for you, or you haven't spoken to a dietitian, you could refer to that and then ask questions about it later.
iCompassion.org, a registered 501c3 nonprofit, is the first free, independent, and trusted online community for people dealing with kidney disease. iCompassion.org allows people to quickly find information regarding kidney disease and treatment options, and to become a part of an online community to get connected, get better, share hope, and give back. Join today and share your story of hope.